Assalamu alaikum wa rahmatullahi wa barakatuh. Today I'll be explaining the third anatomy lecture of the RESP block. Inshallah, this lecture will be very easy and simple and we'll finish it quickly because it's one of the short lectures. So this lecture is going to be about the diaphragm. So we're going to talk about everything to do with the diaphragm. The origin, the insertion, the nerve supply, the action, everything, okay? So let's start. أول شيء we need to know that the diaphragm is a dome-shaped muscle. Okay, it's a dome-shaped muscle. تمام? What is it? It's the most important muscle of respiration. Okay? And it separates the thoracic cavity from the abdominal cavity, and it has some structures that pass through it or pierce it, so it can supply مثلا from the thoracic cavity it supplies the abdominal, and vice versa. It can some structures can pierce from the abdominal to the thoracic. Okay, we're gonna see them. Starting off with the origin. So it has three origins. The diaphragm has three origins. The first origin is the sternal origin. The sternal origin means it's coming from the sternum. Okay, so if you remember, the last part of the sternum was the xiphoid process. So the xiphoid process is gonna be the sternal origin for the diaphragm. So بس which part of the xiphoid process? The back, or the يعني البارت اللي تحت حق ال xiphoid process. Okay, so the back of the xiphoid process is gonna be the sternal origin for the diaphragm. Then we have the costal origin. The costal origin, as we can see here, is gonna be the inner surface of the 6 lower costal ribs and cartilages. So we can see these are the costal ribs and these are the costal cartilages, and this is the inner surface for them. So for the inner surface is gonna be the costal origin for the diaphragm. Okay, I forgot to mention that we're viewing the diaphragm from underneath. It's like we removed the abdominal cavity and we're looking at it from underneath. Okay, so this is how it looks here, or this is where it's located. Tamam. Then the third origin we have is the vertebral origin. So هنا these are the vertebrae. This is the posterior side. So the vertebral origin. So أول شيء we said the sternal origin. Okay, it's gonna be the lower part or the back of the xiphoid process. تمام. Then we have the costal origin. It's gonna be the inner surface of the costal cartilages, the lower six lower costal cartilages and ribs. تمام. Then we have the last origin is the vertebral origin. The vertebral origin, tamam, has two parts. It has something known as the crus and something known as arcuate ligaments. So let's start with the crus. Forget about the ligaments for now. We have two crusses. We have the right crus and the left crus. So just for information to remember, yani, apparently crus means in Arabic الساق, tamam. So it means الساق, which is like the leg. Okay, so if you see here, it actually does look like a leg. Okay, they look like legs. So just to remember it, so we have the right leg and the left leg, yani the right crus and the left crus. Tamam. So the right crus is longer than the left crus. So it comes from where? It comes from L1, L2 and L3, the vertebrae. Okay, so it comes from L1, 2 and 3. The left crus, because it's shorter, it comes from L1 and L2 only. It doesn't reach 3. So it comes from L1 and L2 only. Okay, the left crus comes from L1 and L2. The right crus comes from L1, 2 and 3. Tamam? Now let's move to the 5 arcuate ligaments. These are all under the vertebral origin of the diaphragm. Tamam? The arcuate ligaments, we have 3. Type. We have the one in blue here known as the median arcuate ligament. And then we have the 2 pairs here in green known as the medial arcuate ligament. And the last 2 pairs in yellow are known as the lateral arcuate ligaments. So how are we going to remember them? Let's remember the median, okay, median is 1. Median 1 فيها N ومedian ends with an N, صح؟ فمedian 1 معناها هي واحدة بس. The median is 1. أما the medial with L is 2, they're pairs, and the lateral برضو are pairs, they're 2. Okay, طيب now we need to know where each of these arcuate ligaments arch. Okay, so the median, okay, which is the one خلاص in the middle, the median ligament arches above the aorta. تمام, it arches above the aorta. بعدين we have the medial, it arches above the psoas major muscle. تمام. and the last one which is the lateral, it arches above the إيش quadratus lumborum muscle. تمام. فكده we talked about the 3 origins for the diaphragm. We said the first origin is the sternal origin, is the back of the sphenoid process. Okay, back of the sphenoid process. Then we have the costal origin, it's the inner surface of the 6 lower costal cartilages and ribs. And then the last origin, which is the vertebral origin, has 2 parts. It has the crusses, or the right crus and left crus. So we're gonna right crus, left crus. And then we need to know that the right crus is longer. It's from L1, 2, and 3. The left crus is shorter. It's from L1 and 2 only. And then we have the second part, which is the arcuate, the 5 arcuate ligaments. Okay, the 5 arcuate ligaments. So we have the median is 1 because it's alone. Median is 1. تمام. It arches above it arches above the aorta. تمام. Then we have the medial. Okay, the medial arches above the psoas major muscle. And then we have the lateral, which arches above the quadratus lumborum. Okay, كده we're done with the origin. Now let's go to the insertion. For the insertion we have everything is inserted in one place, known as the central tendon of the diaphragm. This is the one in blue كده. This is the central tendon of the diaphragm. تمام. Now let's go to the nerve supply. The nerve supply is divided into 2 parts, the motor nerve supply and the sensory nerve supply. The motor, from its name, it's for movement, and the sensory is for sensation. تمام. So the motor nerve supply is going to be supplied by the right and left phrenic nerves. Right and left phrenic nerves. So phrenic nerves, whatever we hear phrenic nerves, it's going to be the diaphragm. Okay, it's a nerve supply for the diaphragm. So the motor, we said, it's by the right and left phrenic nerves. The sensory is going to be divided into 2 parts, the central part of the sensory nerves and the periphery, or the peripheral part of the sensory nerves. The central part is going to be supplied by the same phrenic nerves that supply the motor. The periphery, or the peripheral, are going to be supplied by the lower 6 intercostal nerves. The lower 6 intercostal nerves are going to supply the periphery of the sensory nerves. تمام. One more thing here we need to remember is the phrenic nerve. Okay, we need to remember that phrenic nerve is C3, 4, and 5. How do we remember this? Phrenic, let's remember in the phrenic and friends. Okay, so phrenic for friends, and then phrenic ends with C, right? So remember C, then we're gonna write who are the friends. The friends are 3, 4, and 5. 3, 4, and 5 are friends. So phrenic, C, 3, 4, and 5. تمام. Now let's move to the action. Okay, so we have 4 actions for the diaphragm. 3 of them are related and 1 of them is not related, it's just alone. Okay, let's start with the three actions that are related together. The first and most important action we mentioned in the first lecture, if you remember, we said that the diaphragm is the main muscle for inspiration, right? Because it contracts and then it allows the vertical diameter of the thoracic cage to increase, so more air goes in. صح? We said this in the first lecture. So this is the first action of the diaphragm. It contracts, so when the diaphragm contracts, goes downwards, what happens? The thoracic cavity increases its vertical diameter. طيب, تلقائيا, or like eventually, what happens after that? When this diameter, the vertical diameter of the thoracic cage increases, what happens to the abdominal cavity? It decreases, the diameter decreases, right? It becomes smaller because the diaphragm pushes against the abdominal cavity, right? So the second action is going to be increasing the intra-abdominal pressure. The abdominal pressure increases لأنه the diaphragm is pushing against it, لأنه it wants to increase this diameter, which is the thoracic diameter. طيب? So the muscles of the anterior abdominal wall contract, and this causes the increase of the internal abdominal pressure. Okay? The third action that's related to these 2 is this action, which is known as the thoraco-abdominal pump. The thoraco-abdominal pump is basically, صح احنا قلنا the diaphragm contracts, so it moves downwards, it pushes against the abdominal cavity and it increases the vertical diameter of the thorax. So when it pushes against the abdominal cavity, what happens? بيحصل venous return, which is the blood and lymph go against gravity. So the blood and lymph move from the abdominal cavity to the thoracic cavity like this. So here we said the diaphragm contracts, it goes down, this vertical diameter of the thorax increases, the abdominal cavity, the pressure increases. Okay, the pressure increases. فايش بيحصل? The lymph and blood goes up, goes against gravity. Okay, it goes against gravity. So this is known as the thoraco-abdominal pump. Okay, so these are the three actions of the diaphragm. We have one last action. It's not related to these three. What's the action? It's إنه the right crus. Remember the crusses we just said اللي هم الساق. Okay, so the crus is the saq we said, which is the leg. So we said the right crus acts as a sphincter to the lower end of the esophagus. But what does a sphincter mean? Sphincter كأنها يعني it locks it, or it, you know how the water bottle has a cap. So if we want the water to like go out, we can open the cap a little bit and then like flip the water bottle, so some water is gonna go out, right? But the water bottle is still gonna be closing that area. So if we close the water bottle completely and we tighten it, no water is gonna go out, صح? So this is the same thing. The sphincters are like the cap or the thing that opens and closes the space. Okay, so the right crus here, if you remember this is the right crus. We said it's the long one. It comes out from L1, 2 and 3. وهنا this is the left crus, which is the small one. It's from L1 and 2. So let's forget about the left now. We're talking about the right. The right, it comes from here. Okay, this is how it looks like. It's contiguous and so on. And then from here, it comes and it has a fold that goes right above the esophagus. تمام. This is the end or the last part of the esophagus. يعني هنا خلاص the abdomen, it's gonna continue here and then خلاص it's gonna go into the abdominal cavity. تمام. So this is the last part of the esophagus. So the right crus goes and like wraps around the end part of the esophagus. So what happens if this right crus contracts? يعني this right crus كده حيكش contract. إيش بيحصل? It's gonna close this part, right? Because it's like around it, so it's gonna close it. Okay, so when it closes it, خلاص, this closes the end part of the esophagus. So that's why it acts like a sphincter. تمام. قلنا sphincter is like غطا the cap of the water bottle. It's just like the water bottle cap. تمام. So what happens if, for example, this right crus is not contracting enough or it's not working? What happens? This this is not gonna act as a sphincter anymore. So this area or the end part of the esophagus is not gonna be completely closed. So what's gonna happen? Heartburn. Okay. بيحصل heartburn اللي هو الحرقان. بيحصل حرقان في this area لأنه the abdominal, the HCl from the abdomen is gonna go back to the esophagus. تمام. Now we're done with the actions. Now we have the last part of the lecture, which is the opening, okay, for the diaphragm. So قلنا the diaphragm has stuff that pierce the diaphragm to go from the thoracic to the abdominal cavity, or the opposite from the abdominal to the thoracic cavity. What are these things? We have the major openings of the diaphragm, and then we have the other structures. And others are not important. We don't need to memorize them. All we need to memorize really well is the major. We need to know the major very well. Anything else other than the major is going to be another structure, okay? So we have to remember the major. Here we have some questions. They're related to this part as well, so we can go over them after this. Okay, we have the major opening of the diaphragm. The major opening of the diaphragm are three: vena cava opening, esophageal opening, and aortic opening. تمام? Vena cava, from its name, what passes through the vena cava opening? The inferior vena cava. Okay, the inferior vena cava plus the right phrenic nerve. You have to know it's the right, okay, not just the phrenic nerve. No, it has to be the right phrenic nerve. So we said the vena cava opening. What passes through them? The inferior vena cava and the right phrenic nerve. Then we have the esophageal. The esophageal opening, what passes through it? The esophagus and the two vagi or the two vagus, okay? Esophagus and vagus. Esophagus and vagus are always together. whenever there's an esophagus, we have vagus with it, okay? So esophagus and vagus are together. They're always together. The last opening, known as the aortic opening, we have the aorta, the thoracic duct, and the azygos vein, okay? So we're going to call it ATA, okay? So ATA passes through the aorta. So كله A مع A مع A. So ATA passes through the aortic opening. تمام? Now, what else do we need to know? Remember the vertebral levels we took in the first lecture? We need to know the vertebral levels for these openings now. Okay, how are we going to remember them? We're going to remember them in a simple way. So, aortic, okay, what does the aorta do? Yani, what's the function of the aorta? The aorta pumps the blood, or like the heart pumps the blood through the aorta for the whole body, صح? So basically the aorta يعني supplies blood for the whole body, صح? So we're going to remember إنه the aorta supplies blood for the whole body الساعة كم؟ الساعة 12 at midnight. When it's midnight, the blood is going to be supplied for the whole body. So T12 is إيش؟ Is the vertebral level for the aortic opening. So let's remember the aortic opening, البلد حيروح للجسم كله الساعة 12. It's gonna be T12, okay? This is not real information, guys. This is just like to memorize, okay? Then we have the esophageal opening. But the esophageal opening is the esophagus, صح? The esophagus is where the food goes. So we're gonna wake up at 10 and have breakfast, okay? At 10 a.m. It's a bit late, بس ما مشكلة. So we're gonna have breakfast at 10 a.m. So T10 is for the esophageal opening, تمام? Then خلاص at the end of the day at 8 p.m. T8 vena cava. What does the vena cava do? It takes the deoxygenated blood and it does the opposite of the aorta, صح? The aorta pumps or like gives oxygenated blood for the whole body. The vena cava بيسوي العكس, بياخد كل ال deoxygenated blood from the body وبيرجع, صح? So بيرجع البلد الساعة كم؟ بيرجع الساعة 8 بالليل. خلاص at 8 خلاص all the deoxygenated blood is gonna go back to the heart. تمام? So this is how we're gonna remember them. Aortic at 12, T12, the blood is pumped to the body. بعدين esophageal, we're gonna eat breakfast at 10, so T10. And then آخر شيء at the end of the day, vena cava is gonna be at T8. Okay? Okay. One last thing we need to know about these openings are the site. Okay? Where are they أصلا? The aortic opening, أول واحد خلاص. The aortic opening is in the posterior to the median arcuate ligament. Remember the median arcuate ligament? We said it's here. So this is the median arcuate ligament. Remember median, we said median is 1, so it's going to be in the middle, وحدها لحالها. So the median arcuate ligament, we have right posterior to it, we have the aortic opening. Okay? Why is it, يعني subhanallah, why is it here? Because when the diaphragm contracts, okay, this is in the back, صح, the posterior part. So when the diaphragm contracts, it's gonna make this area like increase in size. It's not gonna like ما حيضغط عليها, تمام? And we don't need it أصلا إنه يضغط عليها. We don't want pressure in this place. Why? Because this is the aorta. If the smaller or the narrower it gets, the less blood will go to the body. So that's why we want this area to be as like dilated or as big as possible, so the blood can go in and like go to the rest of the body. Okay? So that's why this is the location here. That's all we need to know is that it's posterior to the median arcuate ligament, okay? This is for the aortic opening. Now let's go to the esophageal opening. The esophageal opening, which is the esophagus, خلاص, it's right here. So this is the esophageal opening. The esophagus قلنا بيمر عندها الesophagus والvagus, okay? It's inside the right crust, okay? We said this is the right crust. وحتى قلنا إنه it wraps around it and it acts like a sphincter, so it's related to the right crust, تمام? So the site for the esophageal opening is the inside of, or it's inside the right crust, تمام? Then the last thing, which is the vena cava opening, where is it? It's inside the central tendon, okay? Remember the central tendon? This is the central tendon, which was the insertion for everything in the diaphragm. So the insertion for everything in the diaphragm is the central tendon. It's the site for the vena cava opening. So it's right here. برضو it's here for like a reason. يعني subhanallah برضو what happens with the contraction of the diaphragm? When the diaphragm contracts, it's gonna go down. Same thing. This what is it called? This central tendon is gonna expand, or it's gonna like حتنشد. لما ينشد إيش بيصير? this opening is gonna become open, like wider, right? So this is what we need. We need the most amount of blood, or the oxygenated blood, to come back to the heart, right? So that's why we open this area more when the diaphragm contracts. تمام. So by that we're done with the major openings of the diaphragm. This is very, very, very important, okay? So remember this really well. Here we have questions. The doctor said what passes to the posterior, passes posterior to the median arcuate ligament. It's going to be the aortic opening. And then on an x-ray, the doctor observes the stomach has moved upwards towards the thoracic. Now let's see this, okay? This is the clinical case. هنا نقول خلاص, this is the other structures. Anything other than these three, تمام, خلاص, and the things that pass through them, يعني vena cava opening, inferior, قلنا inferior vena cava, and the right phrenic artery. The right phrenic nerve, تمام. The esophageal opening, قلنا esophagus and the vagus. Aortic opening, the aorta, the thoracic duct and the azygos. خلاص, يعني ATA. Anything other than that, يعني شوفوا left phrenic nerve مثلا, don't be confused. This is the right phrenic. Here we said it's the right phrenic. So left phrenic nerve is part of the other structures, okay? Not the major structures. Now the blood supply, قلنا superior phrenic artery, inferior phrenic artery, muscular phrenic artery, و intercostals, with the intercostals, okay? This has nothing different. Here the last part is إيش? Hiatus hernia. طيب, what is the hiatus hernia? As we said here, remember this question that I just read? On an x-ray, the doctor observes that the stomach has moved towards the thorax. What does it mean? إنه السtomach اتحرك على الثوركس, or moved upward towards the thorax. This is the stomach, and this is part of the stomach. It moved above the diaphragm. This is the diaphragm. The diaphragm is supposed to separate the thoracic cavity from the abdominal cavity. So it's not supposed to allow anything from the abdomen to go towards the thorax. But it happened. Why did it happen, or what's the reason for this? The reason behind this is the esophageal opening. Remember here, the esophageal opening. So the esophageal opening here is loose. So when the esophageal opening is loose, the esophagus is gonna contract and pull the stomach towards it, and it's gonna pull it upward. So when it pulls it upward, the stomach is gonna pass through this area, or through this esophageal opening, because it's loose, it's not tight enough. بعدين بيحصل لنا إيش؟ الهياتس hernia. تمام. هنا we can see it on the x-ray. This is a normal patient, and this is the patient with the hernia. The normal patient, this is the heart. Okay, here's the diaphragm. هذه كلها هنا diaphragm, and this is the heart, and this is the abdomen. How do we know this is the abdomen? Because there's air. Once we see like black areas كده, this is air. So هنا, this is the stomach, and this is the heart. تمام. So here we can see on the patient with the hernia, إنه this area has air, right? So that means this is the stomach. This is not the heart anymore. The heart is there, it's still there. ولكن the stomach has also moved upwards towards the thoracic cavity. تمام. So by that we have conducted the lecture.